Hey everybody, it is Bree here with Matchwell, and this month we are celebrating with the rest of the nation American Heart Month. If you don't know, more than 600,000 Americans die from cardiovascular disease every year. So we are here today with a registered nurse, Renee Brand. She comes from a cardiac telemetry unit at Piedmont, Atlanta. And she's going to share with us a little bit about what she sees as a nurse and also talk more about what actual healthcare workers can do to make sure that we're not just protecting patients from heart disease, but we're also protecting ourselves.
Yeah.
So, Renee, thank you so much for joining us.
Hi,
And
Bree.
tell us just a little bit about yourself.
Thank you for having me, Bree. And just before I, say anything about my background or, my field in nursing, I just want to say thanks to Bree and Matchwell for identifying the importance of cardiac and heart health. Thank you so much for bringing light to this issue. It is very important. I do hail from a cardiac telemetry floor. I've been a nurse for over 12 years. Cardiac is my passion. And I am seeing a growing number of not just patients with heart issues, but staff as well. And that is increasingly important for us to identify and discuss. So thank you for having me on this platform.
Awesome. Thank you, Renee. Yeah, it's great to have you here and just to hear from your, real life experience. And what you just said about not just seeing it in patients, but also in other nurses.
Yes.
Interesting. So 2019, American Heart just published a statement that said female nurses that we actually have the highest rate of cardiovascular disease than any other profession.
Oh,
So
wow.
tell me, just when you heard that, were you surprised by that at all?
Yes, I know. Yes, because the profession is filled with mostly female nurses. So definitely I can see where that number would come from. Also, female, we're caregivers, we're caretakers. So we give everything, whether on the job or at home. But also no, because I didn't recognize or realize just how bad it is right now when it
Mhm.
comes to us as staff nurses, developing heart issues. So thanks for bringing light to that, and that is key. But again, my peers and I, when we were out at work, we're giving it our all, and so we eat on the go, which is poor dietary intake, especially nurses at night. We eat at a time when our bodies are not at rest. So we are unable to digest properly. That leads to potential weight gain, which leads to heart disease in the long run. The stressors that we face so many stressors at work, especially now during the pandemic. Stress is increasingly high. We also deal with traumatic codes. We deal with our own personal issues. Then we're expected to go home and wear a different hat, whether it be wife or mother or sister, brother, whatever it may be, and still fulfill those roles effectively. So it's almost as if we never get the time to just rest and recoup, in order for us to, basically filter our stressors effectively.
Yeah. And one of the things that you're describing there is a topic I think, I think as nurses, we've always been aware of burnout and
Yes.
know that it exists. I do think one of the unique things that has come from COVID and a pandemic is that the rest of the nation is has become aware of it as well, and seeing the
Yes.
repercussions of burnout. And so tell us a little bit and explain to us, why is it that when we are under constant physiological stress, how does that contribute to cardiovascular disease? So even if
Yeah.
you are, healthy and maybe you exercise
Yeah.
regularly, what are those repercussions of experiencing stress for extended amounts of time?
Yes, and thanks for asking that question. So, stress which is not filtered out of our system properly will lead to a lot of issues internally. And remember, stress is a physiological response to a stressor. And for us at work, when we're experiencing something that's extremely stressful, we're almost in a fight or flight mode. So our body is just surging with adrenaline, and there's no stopping it. There's no coming down throughout that entire 12-hour shift. And so you're constantly going. And when the body is experiencing that over a period of time, then the organs get, and hormones get affected. So your hormones are out of whack. The body is no longer in hemostasis. It is no longer at rest and able to filter the stressor properly. At this point, now your blood pressure is higher. If blood pressure is higher and it's sustained and not treated, then your heart will be affected.
Correct. Yeah, that's right. And so knowing all of that, so I mean, there's so many lifestyle changes that
Uh,
we can implement, whether you're a healthcare worker or not, and it could be overwhelming just looking at everything.
yeah,
So if I'm, a nurse today and I'm listening to this and I know that, yeah, she's describing me, I am under constant stress. I really don't have
yeah,
time to recover for my physiology to exist in that state of equilibrium.
yeah,
What would you recommend? Like if you could pick one thing that a nurse could do
yeah.
and implement in his or her life, what would it be?
Yeah, a nurse's mindset, but I don't have time for that. I know, but I don't know why she's even recommending that. But the
And
truth,
we'll tell our patients to do
yes, and we tell our patients to do it
it.
all the time. But the truth is, we do need respite time. We need quality downtime. And the issues we're seeing is that organizations do not mandate that mental health break. And even if we do take it, we're still home worried that we're, basically getting rid of all our PTO time that we need for a vacation coming up next year. And how are we going to get back the time? And so your system is constantly on a go because you're worried about taking care of your needs at home, paying your bills. And so you don't want to take too much of your vacation or PTO time. But the truth is, we do need that downtime, that
Mhm.
quality downtime, in order to facilitate proper rest and for us to recoup and just filter some of those stressors out.
Yeah, that's a great tip, and I love that you touched on it really needs to be mandated because
Yes,
for most of us, and I've been there myself, you don't wanna take off that time
correct,
because
correct.
maybe you're planning to have a baby and you wanna
Yes,
save it or you're saving
yes,
it for a big trip
yeah,
or
yeah,
you've got children and you're just worried if I
yeah,
use this now for myself, what happens if they
exactly.
get sick and I have to take time off?
Exactly. Of
So
course.
I
And
love
how many of us
that.
can afford to be off without being paid? So
Right.
I understand completely. This is a continuous issue that we're fighting. But the truth and the fact is that we do need that respite time.
Yeah, that's great. Well, thank you, Renee. I'm going to give you time back in your day because I know that you're super
Yeah.
busy, but I appreciate you taking a few minutes just to share your experience as a nurse.
Yeah.
And thank you so much. I know that you are working so hard. You're also
Yes.
getting your master's. So I hope
Yes.
you're taking your own advice and getting some respite. And thank
Definitely
you all
trying.
for watching and, continue just to take care of yourself, get that work-life balance,
Yes.
rest, eat well, and take
Yes.
care of your heart. And for the month of February, wear your red.
Heart health, where you're at. Bye,
Bye,
Bree.
everybody.